Well, how do we use the business of medicine to help the economic engine of Mississippi? That's the main focus that we want to try to do today, is to say we have such a great medical system and community here in Mississippi, and how do we grow that and to have other jobs related to the medical field?
What kind of potential does this offer?
We think it's huge. We have a lot of physicians and a lot of nurses in our community, but we don't have enough, and so we're trying to grow our medical school class sizes, our nursing class sizes, and to grow our community so we have better health care in Mississippi.
One of the requirements to be in a healthcare zone that had less than 375 acute care beds, you had to put together a master plan. That master plan had to be created by an AICP certified planner. That planner had to have experience in Mississippi. They had to send to the governor's office an agreement that was executed by that planner and the community or the developer, and it had to contemplate the directives that was contemplated in the office of the governor's memorandum to the home corporation. And we want to see these plans continue. We want to continue to see them perpetuated around the state, and we want to see communities continue to push this from an economic development perspective. MDA on yesterday certified all 12 of those communities. And to get a certified plan, you have to meet all of those parameters. One way to continue to promote this is to potentially add additional incentives. And that's something that we're going to work towards. We're going to work with the Office of the Governor and MDA to do that. I'd like to bring up to the stage now all of the mayors and economic developers. And as they come up, I'm going to start introducing them. But go ahead and come up, gentlemen.
Governor Bryant's health care initiative is certainly a step forward. We are the proud home of Madison River Oaks Hospital, a new $42 million, 67-bed, state-of-the-art facility, which offers 24-hour emergency care, general surgery, orthopedics, pediatrics, and neurology, to name a few. Healthcare is not just about serving the health and wellness needs of people, but also about serving the economic health and wellness of a state, a region, and a community. All of us must work together to care for the needs of our citizens and ensure that their best interests are served at all times. Like the governor said, it's not just about the hospitals, but about the factories that supply those hospitals with everything from medical equipment and high-tech machines to the goods and services necessary to make these vital and important institutions function. It is also about the jobs created by hiring the diverse group of individuals who render quality care, from the receptionist to the nurse to the x-ray tech to the doctors. The City of Canton will support Governor Bryant's statewide comprehensive strategy that embraces a philosophy that healthcare can be an economic development driver. My team at City Hall, along with Tim Coursey at the Madison County Economic Development Authority, will work with MDA to recruit healthcare-related companies to Mississippi. Using an old hotel slogan, we will certainly keep the lights on for you. At this time, I will allow my fellow colleague, Tim Coursey, to speak in more detail about this plan.
This is what that area looked like in 1997. So it looks like just pasture land, maybe farming land, with an interstate running through it. And that's what it looks like today. The most impressive thing there, people might think, is the Nissan plant, but equally impressive is the amount of development that has occurred over here on the left side of the frame. So that's pretty fantastic, especially for an area that used to be very remote, rural, just 25, 30 years ago. This is my attempt to show you how the process worked for us. As you know, you've heard this a couple times today, that it started off with Blueprint Mississippi. It then transgressed into the Blueprint Mississippi healthcare study, and then the zone legislation was passed. Zones were created. They exist. They're out there. They're functioning. But there were some areas that were left behind. Madison County was one of them, and man, we were frustrated. I'm going to tell you. We have a lot of healthcare investment happening in Madison County, and so we were talking to our legislators, our senators, Rita Martinson, Will Longwitz, all those guys. What do we do here? What can we do? Well, the governor steps in And that's the area where you see the little Governor Bryant's effort. That's the key, the critical component here. That's the chain or the link that linked everything together for us. And then the rest is sort of history. You had Mississippi Home Corp and the reason why the private sector gets involved. And then the master plan was developed and we have our healthcare zone. This is just a little, so you can understand our story, how our zone was created. Again, it took people, these representatives you see were from 15 different organizations, you know, the power company, the city, some of the planning folks, private developers. But at the time, we had what I call a critical mass happening, where we had a private sector developer who needed the home credits, but he has a bigger vision than that as well. You had the local vision from the Canton folks like Arnell, people like Joanne Gordon with vision, and Jordan now that's running the chamber, and we had the county that was looking for opportunities to do something. Since the hospital was built there, we wanted to leverage the hospital into other assets. And then we had a medical overlay district that was being talked about. And then we had the overall development in the area. So we had this critical mass that was already happening that we felt like was a huge advantage for us and allowed us to sort of have the skids greased into creating the zone. I mentioned the assets that existed along that parallel path that we were developing the zone. This is why we think that we have a competitive advantage against a huge amount of competition out there from other states. You can read those. The main things that we try to get our arms around to show people is, not just our location, but the fact that we've got a very diversified healthcare industry around here, including, a lot of people don't know it, but we've got a great little pharmaceutical cluster in Madison County, and we've got several very large medical supply companies. And that's, a little different from what we might have been hearing about today, which is mostly hospitals and ancillary services. We're just as interested in manufacturers of medical devices or advanced materials that are used at hospitals, things like that, as we are in recruiting the ancillary services, the doctor's offices and what have you. The last thing you notice on here is our new Panther Creek Commerce Center, and here's why that comes into play. This is a 2,000-acre site. 1,000 acres of it is an Entergy qualified site. That means that we have all the data to recruit business into it, basically to show them what it will cost to develop an acre of property out there, and that helps MDA with their job as well. So we have this great asset sitting out there that we're taking advantage of. Believe me, we're marketing that every day, and I'll tell you about that in a minute. But then you put the healthcare planning zone, or the master planned area, right there next to it. That's a rendering of what the multi-use area will look like. This is the zone. This right here is the master planned area. I flashed at you. And then this is the actual 5-mile zone right here. What's interesting there is that's a 78 square mile area. There's not many industrial parks that are, I doubt there's any that are that large. That's kind of what you have here, though. You've got a huge asset. And I believe you said there's 12 of those around the state now, Trey. We can sit around and talk about it, and we can do things the old-fashioned way, or we can try to apply some of the things that we feel like we've learned that are cutting-edge technologies to market our product. Really, essentially, what we're doing is implementing part of the plan. Now, there's a large portion of that plan that will be left up to the city of Canton and other folks that are involved, that some of those 15 groups you saw. So I'm just going to talk about specifically real quick what we're involved with. The next thing is, of course, we'll utilize our website. A lot of folks don't know, especially in the economic development world, that your website is your #1 marketing tool. That's where the site selectors go first thing. You can count on it. They're not going to call you first. They may never call you, but they're always going to go to your site if they're interested in your community. Thank you for the opportunity to be here in front of you guys today.
Thanks, Tim. You know, every community has its own unique identity, and you just heard from Madison County and the city of Canton, which certainly has its own unique flavor with its industrial park and its certified site. Next, you're going to hear from the mayor of Batesville, Jerry Autry, who is going to then introduce Sonny Simmons, the economic developer for Panola County. Thanks.
What we did is we got involved about, I've been trying for about 2 years to get tax credits to rehabilitate all my units in Batesville that were in very bad condition. And Wishcamper, we were trying to work together to get this done. And then lo and behold, the governor comes up with this plan. And as you know, you can get tax credits and you can rehab your old dilapidated buildings. And that's what we did. We were doing it right now.
Wishcamper, company that specializes in rehabilitation of dilapidated type properties throughout the country, have been trying to get tax credits to allow them to rehabilitate about 102 units of low-income housing in Batesville. There's 3 separate complexes. With the governor's initiative and the new regulations that are taking place now, we were able to help them and access about $750,000 worth of tax credits. That allowed them to use that and leverage those tax credits to get the funding necessary for the rehabilitation of those units. As I said, the investment's going to be, the initial investment's going to be about $5.6 million on those 102 units. I'm going to show you some examples of what they start with. They start with apartments that are, I mean, in total disrepair, unlivable. This is probably an extreme case of that, but some of them are not far from this example. The finished product looks more like this when they're finished. The outside of those apartments are dilapidated as well. When they're finished, very, very nice, livable apartments, high quality of life for the residents. They displace the residents during the construction phase, move them back in, but they also put a very stringent set of regulations on these people when they come back in. They have to maintain these apartments. We've viewed some of these. The mayor and I took a tour of some here in Jackson, and they are as nice as you'll ever see. They're well kept. You don't see anything around the apartments as far as garbage or anything like that, or toys in the yard or anything. They're nice as any kind of apartment anywhere. They're very well taken care of, very well managed. Some of them are fenced, even with gated type access. So that's what's taking place in Batesville. So that's really our immediate results of the healthcare study. Now let's talk about where we're located, what our plans are for going forward. Batesville's located, as you probably know, in the northwest part of our state. We're only 45 minutes, though, from the Memphis metro area. We're 20 minutes from the University of Ole Miss. We're 40 minutes from Clarksdale and about 45 minutes north of Grenada. So strategically, I don't think you can be in a much better location where we are. We did fall within the 5-mile radius of 3 contiguous counties that met the minimum criteria. And that was Tate County to our north, Lafayette County to our east, and of course Panola County. That brought us up to the 392 acute beds, certificate of need beds that actually qualified us for a health care zone. Using our hospital as a nucleus, the 5-mile radius takes in the entire city limits of Batesville. It also takes in our new industrial park, which is just outside the city limits at our airport. It's a 250-acre, fully served industrial park that we opened last April. It's not only just a regular industrial park, it's a state-of-the-art. It's actually paved and it's guttered, and it has a wrought iron fence across the front of it with brick columns every 40 feet. And it's not just shovel ready, it's pad ready. We've got 2 100,000 square foot pads, one 50,000 square foot pad. We have a courtesy car at the airport, which is in walking distance actually of this park. We already have our first location. They built there. They're already in operation. We've just sold another 15 acres to another company. They will start building right away, and we've got a third company that's going to probably make a commitment within the next month. So that park is ideally suited. It's less than a mile from the interstate. We feel like that's what we're going to market for healthcare industries, or like the medical industry, that like injection molding companies, for example. That's something that you may not associate with the medical industry, but it certainly is. So that's one of our target markets already. We're going after companies like that and other medically related companies. This shows you the hospital as a nucleus here. It shows it also takes in our entire downtown area, and then our industrial park we just talked about is located right here just outside the city limits. But the downtown area of Batesville is already developing very quickly with medical offices. We have 2 doctors' offices there that didn't exist 2 years ago, dental offices, optometrists, pharmacies, and some other buildings that are available now that some other doctors have shown interest in. So we're going to help develop that area as well as the area around the hospital. Our hospital is growing in leaps and bounds, and that's good for all of us. Just a few years ago, they had about 150 employees. Now they're up to over 369 employees with 68 physicians. For a town of less than 7,500, I think that's quite impressive. That company, HMA, who's bought the hospital about a little over 2 years ago, has now invested over $42 million in that hospital, bringing it up to a new standard. They've increased the services of the hospital. In addition, they've done a complete renovation of what they call their West Campus, which is a 57-bed behavior health care center. So they've invested a ton of money in that hospital. Not only that, but recently they just purchased another 8 acres of land that the city owns, and they're going to be building doctors' offices there. So we're going to expand that as well, and that still gives them room to grow. The impact to our community is this, though, from the hospital. From the 369 associates and doctors associated with that, we're looking at more than a $28 million circulation of annual payroll. We're also looking at a $6.4 million in uncompensated care. That was the latest we had in 2011. But they pay over $300,000 in local taxes. And so you can imagine, as we grow this industry, as your communities grow this industry, you can imagine what that's going to do to your local tax basis. It's going to be tremendous if we do it right. Not only do we have a hospital that's growing, several years ago, the Panola Partnership, our economic development group, recruited Aerovac Life Team to Batesville. They're Aerovac helicopter unit, and they built a facility just behind the hospital. Not only do they have their facility there, they built living quarters for their maintenance people, and it's a maintenance headquarters for their entire fleet. So that's another huge economic impact and another service that we can provide to patients coming into our area. Now, this is the master plan. I think this is so important. If you'll look, the hospital located here, but the property located right here is owned by the city of Batesville. That's where the new doctor's office is going to be located. All of this property here, though, to our west, which is along the interstate, and the property behind the hospital here is privately owned. And we have met with those landowners during this whole process of what we're trying to accomplish right now, and all of them know what our goals and objectives are to grow this healthcare industry, and they're on board with this to provide these properties at a reasonable price when we have prospects coming in for that reason. The Civic Center for the Batesville is located here, so it's going to be kind of a multi-use area that we're going to continue to develop very quickly, we feel. We feel this with a targeted and aggressive marketing strategies which we plan to implement. This comes from the study that shows, and we asked them to be conservative with these estimates. We're looking at the possibility of about $120 million new investment by the year 2020, over 1,100 new jobs potentially, and approaching a $50 million annual payroll. That is a huge impact on a community of 7,500 people. But that's not going to be unique just to the Batesville at 7,500. Every community in this state is going to have an opportunity to capitalize on some of this that we're talking about here today.
This initiative that the governor, and we all should applaud him for, has really been an opportunity for our town, a small town like Holly Springs. You know, when I first saw it, and being a member of the legislature, I had the opportunity to see this legislation, and I immediately saw the potential in it. I immediately saw how this kind of legislation could be a big plus to a community like ours, in that we were always faced with some challenges as it relates to the access to health care. We were challenged with the possibility of having the economic development and jobs that come along with it. And so we knew what it was like to try to use an economic tool such as this to build on our economic prosperity in the community. But it really began actually with my experience with a private owner of a hospital there in Holly Springs, a small 40-bed acute hospital called Alliance Healthcare System. In fact, the president of that hospital, the CEO of that hospital, Mr. Perry Williams, is here today. And some years ago, they were committed to trying to make a difference in our community as it relates to their commitment to affordable and accessible health care in our community. And so that commitment led them to come up with some ideas as it relates to a plan, and they planned what we call the medical campus some years ago. Now, the problem with that plan is that, as it has been mentioned earlier, a plan like that requires that you have the kind of funds that will allow you to do the development, or at least some incentives that would allow developers to come in and make the investment. And so the plan was there, the commitment was there, but what we lacked was some of the funding and some of the incentives that would make it a feasible thing to do. And so, lo and behold, I'm sitting in the House chamber as a member of the Mississippi House of Representatives, and we run across the legislation that would establish the health care zone. A wonderful initiative, Governor, and we certainly appreciate you. And I think early on in the process, we shared with you that we would be behind this legislation 110%. And we have been, and we supported that legislation all the way through the process. And so we're just delighted to now say that we're one of the communities that now has a plan that's on the table. We're one of the communities that has now been able to benefit from the process that would allow some of the housing development to be done. We are seeing some of those housing developments coming up right now. In fact, I'm sure the gentlemen are out there working on that complex some today. And that's because of the initiative that has actually been a piece of legislation that really means something to the people of our community. And because it means something to the people of our community, because it has made a difference, we are right now as a community poised and ready to build upon that and add that to the portfolio that already exists. Now, with me today is a gentleman that works with our Industrial Development Authority, Mr. Justin Hall. And Mr. Hall will share with you some of the other initiatives that will be combined with our healthcare zone initiatives and show you how Marshall County and Holly Springs has paired up with the public sector and the private sector, and how we have also partnered with the different branches and sizes and levels of government just to make this work for a small town like Holly Springs. Ladies and gentlemen, Mr. Justin Hall.
Location. We're in a great location. We're in the Memphis metropolitan statistical area, and our road network is a definite asset. You can see we're bisected by future I-22, Highway 78 currently. I-269 is currently under construction. This is the new intermodal highway of the future. It's the direct connection to Canada and Mexico. This is going to provide, when it's completed, direct connection to I-55 and I-40 from Marshall County. We have 3 rail lines that serve Marshall County, and we're within 30 miles of the Memphis International Airport, the FedEx Hub, and the Port of Memphis. Show you a quick little map of, I'm losing my screen here. If y'all can see it, we're good. Just to kind of point out the area, get you a visual here. 30 minutes from Memphis, we're about 50 minutes from Tupelo to the south. We've got Batesville, Sonny just talked, is down by on 55. Also, Senatobia and Northwest Community College. They're a huge player. They're playing a major role in our economic development. The programs that the Mississippi Community College system offers to these companies coming in are just unbelievable. Training and career technical services. Talking a little bit about the healthcare plan, I'm going to let Chris Watson tell you maybe more detail. But in 2008, the Holly Springs Commons PUD was created. This was a joint effort between the city and the county, really got things moving. There were plans. Alliance Healthcare was planning on building a new hospital and still have plans to do that. Dr. Williams was wanting to set up a state-of-the-art medical facility. Marshall County and Holly Springs created a TIF district to help finance this, and I believe currently over $9 million have been invested in direct infrastructure dollars to get this plan and district in order. Part of this PUD, we created 32 acres are reserved for medical-related industry. Here's a map of the PUD. I have to look down here to see it. 220 acres. All these sites in the green that are highlighted are pad-ready sites. They consist of retail, commercial. The area in the red would be the 32-acre medical park. The purple area is already has been built out. Williams Medical Clinic sitting in that location at the moment. The healthcare plan, we had four major goals that we wanted to implement, and phase one has been implemented. Williams Medical Clinic built in 2008. They're currently they have state-of-the-art facilities, really nice. It's a definite asset to the community. Currently seeing about 35,000 patients annually. Phase two, we're still working with Alliance Healthcare to get our planned hospital in. Phase three will consist of a health and wellness center. We'll kind of educate the public, have some activities, a center there, to walking trails. And also phase four is going to consist of a School of Allied Health. We're going to work with Northwest Community College, our community college system, and also the Career Technical Center in Holly Springs to start training and creating jobs locally and having placement. We've got the medical park. You can see Williams Clinic in the northwest corner. Hospital's planned to be just south of that, and then the Wellness Center and the School of Allied Health will be behind.
A lot of things, it takes a community and it takes a group effort. It's all about teamwork, and we've assembled a great team. The Mississippi State Medical Association, the Mississippi Economic Council, the Chamber Partnerships, governmental help. There's a lot of great folks that are involved and interested in how to do this.
Are you encouraged by everything that you've seen and heard here today?
I am. It's very exciting. We have over 700 people, attendees today for our summit, and so there's a lot of interest and enthusiasm. I sure am.
I think the end result is no matter whether you're from a big city or a small town, you have a stake in this future of healthcare as an economic driver. And if you're with a small town, which has a small town regional medical center or a hospital that serves a small community, it can tie into this in a big way. And of course, in the major urban communities, they've got extensive footprints now that can be expanded significantly.
If people have questions or like more information, what should they do?
You go to MEC.ms, www.mec.ms, and they can download the studies and sign up to be a stakeholder.